Hi, I'm Gail, and I'm a certified diabetes educator. Today we're going to be talking about dosing Xultophy 103.6. It may help to have your tracker and your Xultophy 103.6 pen handy as you watch this video. Your healthcare provider should have told you how to start and adjust your daily dose. If you didn't get those instructions, be sure to talk with your healthcare provider. Before we begin, there are some important things you should know about Xultophy 103.6. Xultophy 103.6 is an injectable prescription medicine that contains two diabetes medicines, insulin degludec 100 units per milliliter and liraglutide 3.6 milligrams per milliliter. Xultophy 103.6 should be used along with diet and exercise to lower blood sugar or glucose in adults with type 2 diabetes mellitus, when blood sugar levels are not well controlled on 1. Long-acting insulin, less than 50 units daily, or 2. Liraglutide, less than or equal to 1.8 milligrams daily. Your healthcare provider may have prescribed Xultophy 103.6 because he or she feels it may help improve your blood sugar. We want to help you get off to a good start with Xultophy 103.6. Starting a new medication can take some time and effort on your part to help you reach your blood sugar goals. It all begins with taking your medication as directed. You should take Xultophy 103.6 once daily, at the same time each day. You can take your dose with or without food, so you don't have to plan your dose around meals. Do not take more than 50 units of Xultophy 103.6 each day. If you miss a dose, take that dose at your next regular dosing time. Do not take an extra dose or increase the dose to make up for the one you missed. Rotate where you inject with each dose to avoid repeatedly injecting in the same place. Never share your Xultophy 103.6 pen with other people, even if the needle has been changed. To help you remember to take Xultophy 103.6, link it to another activity you do the same time every day, like brushing your teeth in the morning or after you walk the dog at night. You can also try setting a daily reminder on your computer, phone, or watch. It's important to track your blood sugar. Your healthcare provider will tell you how often you should check your blood sugar. He or she may have recommended testing your blood sugar every morning before breakfast. This is known as your pre-breakfast blood sugar, or your FPG. FPG stands for fasting plasma glucose. Fasting means not eating, so it makes sense that your fasting plasma glucose, or FPG, is your blood sugar reading after not eating or drinking anything for at least 8 hours. So check your blood sugar as recommended by your healthcare provider, and develop the habit of writing down those numbers every time you check. Keeping track of your blood sugar helps you and your healthcare provider understand how well your treatment plan is working. To help you keep track of your numbers, you may have gotten a progress tracker from your healthcare provider with your Xultophy 103.6 prescription. If not, you can download one here. The numbers you record will help you and your healthcare provider know if you need to adjust your Xultophy 103.6 dose to reach your target range. When you start taking Xultophy 103.6, you'll take the starting daily dose recommended by your healthcare provider. Typically, it is 16 units. Your healthcare provider should have given you a target range for your pre-breakfast blood sugar. If not, ask what your target range should be. The American Diabetes Association recommends keeping your pre-breakfast blood sugar between 80 and 130, but you and your healthcare provider will decide your specific target range. Do you have your progress tracker with you? All right, let's start tracking. Start by writing in the pre-breakfast blood sugar target range your provider gave you. See the box there, right below the A1C goal chart? That's where you'll write it in. Every morning when you check your blood sugar, write that day's number in your progress tracker. Did you check your blood sugar before breakfast this morning? Look at your meter and see what your number was. Fill in that number and today's date on the first blank page of your tracker. Good! Your healthcare provider should have given you instructions on how to adjust your Xultophy 103.6 dose based on these numbers. The Xultophy 103.6 prescribing information recommends you adjust your dose every 3 to 4 days until your target range is reached. In our example, this person's healthcare provider recommended they adjust their dose on Tuesday and Saturday. So, on the days your healthcare provider told you to, compare your pre-breakfast blood sugar readings with your target range and adjust your dose as needed. For example, if your pre-breakfast blood sugar is more than your target range, you'll increase your Xultophy 103.6 dose by 2 units. If it's less than your target range, you'll decrease your Xultophy 103.6 dose by 2 units. And if it's within your target range, don't adjust your dose at all. Don't change how or when you adjust your dose without talking to your healthcare provider first. Keep checking your numbers and adjusting your dose as your healthcare provider instructs, and you'll be on your way to managing your blood sugar. Hey, don't be in such a rush. We're not finished yet. It may take a little time to find the Xultophy 103.6 dose that works for you. So don't get discouraged if you're not seeing the results you had hoped for right away. Keep taking Xultophy 103.6 and tracking your blood sugar as your healthcare provider recommended so that you can see the results of your treatment and share them at your next appointment. If you have questions or concerns, you should call your healthcare provider. He or she should be the one who answers specific questions about your treatment plan. If you have additional questions about using your Xultophy 103.6 pen, a diabetes health coach who is a certified diabetes educator like me is here to help. Call us at 1-866-696-4086. We know it can be challenging to start a new medication, but keep taking your medication as prescribed, stick with tracking your blood sugar, and adjust your dose as directed by your healthcare provider. You can do this. Xultophy 103.6 and you.
Important safety information. What is the most important information I should know about Xultophy 103.6? Xultophy 103.6 may cause serious side effects, including possible thyroid tumors, including cancer. Tell your healthcare provider if you get a lump or swelling in your neck, hoarseness, trouble swallowing, or shortness of breath. These may be symptoms of thyroid cancer. In studies with rats and mice, liraglutide, one of the components of Xultophy 103.6, and medicines that work like liraglutide caused thyroid tumors, including thyroid cancer. It is not known if Xultophy 103.6 will cause thyroid tumors or a type of thyroid cancer called medullary thyroid carcinoma, MTC, in people. Who should not use Xultophy 103.6? Do not use Xultophy 103.6 if you or any of your family have ever had MTC, or if you have an endocrine system condition called multiple endocrine neoplasia syndrome type 2, MEN2, you are allergic to insulin degludec, liraglutide, or any of the ingredients in Xultophy 103.6, you are having an episode of low blood sugar. What should I tell my healthcare provider before using Xultophy 103.6? Tell your healthcare provider about all your medical conditions, including if you have or have had problems with your pancreas, kidneys, or liver, have severe problems with your stomach, such as slowed emptying of your stomach, gastroparesis, or problems with digesting food, are pregnant or breastfeeding, or plan to become pregnant or breastfeed. It is not known if Xultophy 103.6 passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Before using Xultophy 103.6, talk to your healthcare provider about low blood sugar and how to manage it. How should I use Xultophy 103.6? Read the instructions for use and take Xultophy 103.6 exactly as your healthcare provider tells you. Do not change your dosing schedule without first talking to your healthcare provider. Do not inject Xultophy 103.6 into a muscle or vein. Use Xultophy 103.6 at the same time each day with or without food. Do not take more than 50 units of Xultophy 103.6 each day. Check the pen label each time you give your injection to make sure you are using the correct medication. Do not share your Xultophy 103.6 pen with other people, even if the needle has been changed. You may give other people a serious infection or get a serious infection from them. Check your blood sugar levels. Ask your healthcare provider what your blood sugar levels should be and when you should check them. Your dose of Xultophy 103.6 may need to change because of change in level of physical activity or exercise, weight gain or loss, increased stress, illness, change in diet, or other medicines you take. What should I avoid while taking Xultophy 103.6? Do not drive or operate heavy machinery until you know how Xultophy 103.6 affects you. Do not drink alcohol or use prescription or over-the-counter medicines that contain alcohol. What are the possible side effects of Xultophy 103.6? Xultophy 103.6 may cause serious side effects that can be life-threatening, including inflammation of your pancreas, pancreatitis. Stop using Xultophy 103.6 and call your healthcare provider right away if you have severe pain in your stomach area, abdomen, that will not go away, with or without vomiting. You may feel the pain from your abdomen to your back. Low blood sugar, hypoglycemia. Signs and symptoms of low blood sugar may include shakiness, irritability, fast heartbeat, dizziness, weakness, sweating, confusion, drowsiness, hunger, headache, and feeling jittery. Kidney problems, kidney failure. In people who have kidney problems, diarrhea, nausea, and vomiting may cause a loss of fluids, dehydration, which may cause kidney problems to get worse. Serious allergic reactions. Stop using Xultophy 103.6 and get medical help right away if you have any symptoms of a serious allergic reaction, including itching, rash, or difficulty breathing. Heart failure in some people if taking diabetes medicines called peroxisome proliferator activated receptor (PPAR) gamma agonists with insulin-containing products like Xultophy 103.6. This can happen even if you have never had heart failure or heart problems. If you already have heart failure, it may get worse while you take PPAR agonists with Xultophy 103.6. Tell your healthcare provider if you have any new or worse symptoms of heart failure, including shortness of breath, tiredness, swelling of your ankles or feet, and sudden weight gain. Low potassium in your blood, hypoglycemia. The most common side effects of Xultophy 103.6 may include stuffy or runny nose, sore throat, upper respiratory tract infection, increased blood levels of lipase, nausea, diarrhea, and headache. Indications and usage. What is Xultophy 103.6? Xultophy 103.6 is an injectable prescription medicine that contains two diabetes medicines, insulin degludec 100 units per milliliter and liraglutide 3.6 milligrams per milliliter. Xultophy 103.6 should be used along with diet and exercise to lower blood sugar, glucose, in adults with type 2 diabetes mellitus when blood sugar levels are not well controlled on 1. Basal insulin, less than 50 units daily, or 2. Liraglutide, less than or equal to 1.8 milligrams daily. Xultophy 103.6 is not recommended as the first choice of medicine for treating diabetes. It is not known if Xultophy 103.6 can be used in people who have had pancreatitis. Xultophy 103.6 is not recommended for use in combination with any other product containing liraglutide or another GLP-1 receptor agonist. Xultophy 103.6 is not for use in people with type 1 diabetes or people with diabetic ketoacidosis, increased ketones in the blood or urine. It is not known if Xultophy 103.6 can be used with mealtime insulin. It is not known if Xultophy 103.6 is safe and effective for use in children under 18 years of age.